So we have the path for the members.
Is it just these four that aren't speaking? But okay, I don't know. I believe so, but I'll let you know. Senator Sanders isn't showing up.
It's so hard to answer that. Nobody's like, so I don't even know.
1 minute.
Show me what democracy looks like!
This is what democracy looks like!
Show me what democracy looks like!
This is what democracy looks like!
Show me what democracy looks like!
This is what democracy looks like!
Okay, we are still just waiting 1 minute for Senator Sanders. He should be here in just a second. They want it only.
I have eyes on your man. Yeah, it's your job. Literally, I'm not your boss's babysitter.
There must be a better.
Look at their bright colors.
We keep all of that.
The red I can do. It's in the scheme.
Yes, I see him. I see him.
Green is not part of the palette. There we go.
There he is.
Who has the power? We have the power.
Good afternoon, everybody. Thank you so much for joining us
Yes,
on this incredibly important day. I mean, just look at this organizing movement, all these people that have come from all over the country to lift up Medicare for all. Healthcare is a human right. We are going to get this done. Now, I want to recognize my incredible co-sponsors of this legislation. First and foremost, the man who brought this to the center stage, Senator Bernie Sanders. And of course, in the House, my co-sponsor, lead co-sponsor, Debbie Dingell. And the 112 co-sponsors of Medicare for All, the most co-sponsors we have ever introduced with in the House of Representatives. You're going to hear from a number of our colleagues today, but I wanted to recognize those that are not going to necessarily have a chance to speak. Representative Barbara Lee. Jill Takuda. Valerie Fouché. Greg Kassar. Rashida Tlaib. And Troy Carter. If I missed anybody, I'll keep trying to add to it. So let me just say that having 112 original co-sponsors, remember, that is with a House minority just for a couple of years, just until we get back into the majority of Democrats. That is over half of the Democratic caucus here in the House. And I am confident that working with each of you to organize in your districts, we will continue to add to that for health care, including in rural Wisconsin, in addition still passed a resolution endorsing universal single-payer health care. And that is because the message of Medicare for All is simple. Health care is a human right. Everybody in and nobody big pharma instead of patient care and wellness. Join me in saying shame. Shame! 28 million people don't have health care coverage at all. Shame! Even with people who have insurance in 2022, 38% of those people who had health insurance put off medical care because they worried about the cost of that medical care. Shame! Millions are drowning in medical debt. Millions more are one broken bone, one car accident, one new prescription away from medical bankruptcy. Shame! About 68,000 people die every single year because they cannot afford health care. Shame! And tying health insurance to your job is cruel and harmful, as we saw during the pandemic when 27 million Americans lost their jobs and lost their health care in the middle of a pandemic. Shame! So let me be clear. This must end. We need Medicare for all, and we need it now. Our vision is laid out clearly in our bill. Medicare for all takes our most popular program, Medicare, provides it to everyone, and expands it so that it covers everything that you need to be well. This is about wellness, about preventive care so you don't wait until you get sick to get the care you need, about mental health care. It includes long-term care. It includes dental, vision, and hearing, reproductive care, gender-affirming care, and all of that without copays, deductibles, private insurance premiums, or other unnecessary fees. No more surprise bills. No more out-of-network providers. No more worries about how to get the care that you need for yourself and for your family. No more battling with private insurance companies who are telling you that they somehow know better than your doctor. No more. 3 years ago, in this House, we had the first ever hearings on Medicare for All, working with leaders like our then chairman of the Rules Committee, Jim McGovern, to hold an absolutely amazing hearing. And that hearing and the ones that followed were so compelling because they were the stories of people across the country who are battling with a broken healthcare, not system, but collection of for-profit centers whose only purpose, really, is profits for themselves instead of patient care. We are up against big lobbying forces, but I'm here to tell you as an organizer for 20 years before coming to Congress that our movement is way more powerful than they are, and it is growing every single day. So I want to thank all of the incredible advocates who you'll hear from today, all of the people across the country who are here to make sure that people understand that healthcare is a human right and that the time for Medicare for all is now. And with that, I am so proud to have in the House as my co-lead sponsor, an amazing advocate for Medicare for All who has been there every step of the way, Representative Debbie Dingell.
Thank you, Camilla. Good afternoon, everyone, and thank you to all of my colleagues and to all the advocates. You're the ones that providers and everyone else who, and Bernie did bring it to the center. But we're all here as we reintroduce this bill. You know, I'm wearing a mask because I tested positive last week. But you know what? When I was sick, I could go to the doctor. I could get the medicine that I needed. I had the tests at home, and I could afford to pay for the mask, and I'm being safe. So I didn't come back to work so I knew I was safe. I'm wearing the mask as the CDC said. The public health has expired, and too many people, COVID's not gone. I'm exhibit A. But too many people can't go to the doctor, can't afford the medicine, don't have the test, and can't even stay home or admit that they have it because they can't afford not to go to work. That is wrong. It is long past time for the United States to join. This is a competitive issue. Every other industrialized nation in the world guarantees its citizens access to health care, period. It's a right, not a privilege. It's a right. If you're sick or you get hurt, you should be able to go to the doctor without being worried about going bankrupt or whether they'll even take you. We've all heard too many stories of people who didn't seek treatment or take the medicine that they needed. Or by the way, I'm always out there on preventative tests and people say, I'm not going to get my mammogram. I'm not going to take the prostate test because even if I'm positive, I can't afford the treatment. I can't get it. That is morally wrong and unacceptable.
Shame!
Countless lives have been lost because people don't get the treatment they need and deserve because they can't afford it. And quite frankly, it's unconscionable. We can and must fix this system. The COVID-19 pandemic didn't create the flaws in the healthcare system, but it shined a light on how broken it is.
That's right. That's right.
We've been broken before humans. You know, this fight started in the 40s. My father-in-law was one of the first people that authored universal health care legislation, and people said, don't you get discouraged? His work in the 40s got us Medicare in 1965. And John Dingell introduced universal health care, the man I was married to and loved. And when he was sick, I was luckier than 99% of the people. We had Medicare, we both had insurance, and I couldn't make the effing system work. It was so broken, I pounded my head against the wall. 90 days and you're gone. The nightmare. What do everyday normal people do? We're not normal. We are, but we're not. And when he died, before the day of his death, I promised him I'll get this bill over the finish line. And that's right. He talked about that in the last hour of his life. He knew how many people needed access to health care, how they couldn't afford to go to a doctor, and they needed to have that access. We've made a lot of progress. We cannot give up. No. And we're not going to stop until every single American has that access to health care that they need. Yeah. And we're going to keep fighting, all of us, until we get it done. Yes. Now, I mean, I couldn't have two better partners than Pramila and Senator Bernie Sanders, who I have fallen in love with twice doesn't matter.
Don't tell us.
But you know, he's not afraid to say what needs to be said. He's not afraid to get up and fight. And this man is our partner, and we're going to fight and bring it over the finish line.
Let me thank Pramila and Debbie and all of the co-sponsors here in the House, and the 14 co-sponsors and more coming in the Senate, and the millions and millions of people, including a growing number of doctors and nurses. Yes. We had a wonderful meeting last night, hundreds of doctors and nurses. And what they are saying is, you know what, we want to practice healthcare that prevents illness, that treats our patients. We don't want to work with the insurance companies and the drug companies. And more doctors and nurses are coming on board the Medicare for All movement. There's not much that I can add to what Pramila and Debbie have said, except perhaps this. People say, well, you know, Medicare for All, you want to guarantee health care to all people, that's expensive. It is, but it is less expensive than the dysfunctional, broken system that we have right now. What everybody up here wants to do is we want to put money into doctors and nurses and getting kids healthy and preventative health care. We want our dollar to go to healthcare, not to huge profits for the drug companies and the insurance companies. And my conservative friends who are worried about how much money we spend, they should know we spend $13,000 for every man, woman, and child in healthcare. Could you believe that? $52,000 for a family of four, twice as much as the people of any other country. So there's a simple question we got to ask ourselves: how come in Canada, in Europe, all over the world, they spend half as much per capita on healthcare, and they guarantee healthcare to all of their people? Pretty simple question. And the answer is those healthcare systems are based on the need to provide care to all in a cost-effective way, not to make huge profits for the drug companies and the insurance companies. And I would add, to just conclude by saying this: it goes without saying, and the overwhelming majority of people, Republicans, Democrats, Independents, understand that if you're rich or if you're poor, you are entitled to quality health care. The insanity of a system that says to a Walmart's worker who has no health insurance or miserable health insurance, he or she can't get the quality care that a CEO on Wall Street gets. People believe correctly that is immoral. It's not what this country is supposed to stand for. But the last point that I want to make is we are struggling right now to make sure that democracy stays alive in this country. And one of the reasons why so many people are giving up on democracy, turning to extremism, is they look over here and they say, does anybody understand what I am going through? You heard what Debbie said, what Pamela said. Does anybody know I can't afford health care? I come out of the hospital and I go bankrupt. Can you imagine? 500,000 people in this country go bankrupt because of medically related illness. So not only do we have got to provide quality care to all of our people as a human right, we've got to reaffirm our belief in democracy, that this government works for all of us and not just powerful corporate interests. Thank you all very much.
Thank you so much, Senator Sanders. We've also been joined by Representative Jan Schakowsky and Elsie Stansberry. We have an incredible group of Congress members who are supporting this. And next, I want to introduce one of our incredible community advocates. Mike Walsh is from People's Action. He is a lifelong resident of Maryland, and he is here to tell his story among the many across the country. Mike Walsh. Hi.
Hello, everyone. So my name is Mike Walsh. Like Ms. Jaipal said, I'm a lifelong resident of Anne Arundel County, Maryland, in Baltimore. And in 2018, I was unemployed and uninsured. And after a couple of weeks of coughing up blood that I avoided getting checked out for fear of care I couldn't afford, I finally took myself to an ER where a CT scan found a tumor in my lung. The cancer diagnosis came soon after: Ewing sarcoma and metastatic melanoma, rare and an immediate threat to my life. I could no longer avoid being uninsured, and so began the complicated and frustrating journey of selecting the insurance plans to get me the life-saving care that I needed. Treatment and surgeries followed all through 2019 and 2020, and all the while I never got a break from figuring out what insurance I needed, how much it would cost, and whether I could even afford it while unable to work due to grueling and wearing treatments and surgeries. So while in my story I'm able to stand here today, I know there are millions of people who can't. Our lives should not be at the mercy of the disgraceful, private, for-profit health insurance industry. And we must transform the system into one that actually delivers health care for all. And I know that we must organize the people hurt by the private insurance industry. And so that's why Progressive Maryland, we are organizing with People's Action on the Care Over Cost campaign. Each year, over 248 million people are denied care or hit with bills they can't afford. Too often the result is bankruptcy or death because health insurance companies prioritize their profits over people's care, and that ain't right. Shame. An improved Medicare for all means no one will profit off our suffering. And I'm grateful to Senator Sanders, Representatives Jaipal and Dingell for continuing to lead the way in Congress, year after year. And for all of you here standing in solidarity, fighting because healthcare is not only a human right, it's what we deserve.
Thank you, Mike. And next up, I want to introduce Joyce Means, who is another incredible community activist from the Arkansas Community Organizations, an affiliate of the Center for Popular Democracy, working to organize low-income and working-class families for social and economic justice in Arkansas. Welcome, Joyce.
The wealth of the wicked is stored up for the righteous. The righteous is the ones that we can trust to do the right thing with the money. Put the money, our money, into Medicare for all. No one should ever have to choose between food and medicine. Yes. Good afternoon. My name is Joyce Means, representing the Center for Popular Democracy and Arkansas Community Organizations. I have to make the choice between food and medicine. It's my story today because I was faced with this same issue. On March 17, 2023, I received a letter from DHS dated March 10, 2023. As I read on into the letter, it states notice of action effective March 31st, 2023. Such a short notice. My Medicaid case will be closed. The devastation I felt is unimaginable. I can't describe it to you how I felt. As a result of this my Medicaid being cut off, I lost my extra benefit plan, which allowed me $180, which consisted of food, over-the-counter medicine, and zero copay for my prescription medicines. Medicare for all is the way to go. And health care is for everyone. No one should ever have to choose between food and medicine. Yes. My health care is not for sale. That's right. It's not for sale. So we must go the way, and these are the people that are going to be trusted, and they can be trusted to do the right thing, and that's Medicare for all. Thank you for allowing me to share with you.
And our third advocate that I want to bring up is Deborah Berger. She is a registered nurse. She is a member of the Council of Presidents of National Nurses United, the largest U.S. union and professional association of registered nurses with nearly 225,000 members nationwide, and a key partner for us on Medicare for All from the very beginning.
Okay, so I want to thank Senator Sanders, Congresswoman Jayapal, and Congresswoman Dingell for introducing Medicare for All Act and for being steadfast in fighting for universal health care system where health care is a human right guaranteed for all people in the United States. Yes. I am so honored and thrilled to be with all of you today for the introduction because it gives all of us hope that there is a better world. As you said, my name is Deborah Berger, and I've been a registered nurse for over 45 years. And the stories that I've seen because of the healthcare system that we have, or lack of a system, I've seen, and many of my colleagues have seen, patients die needless deaths because of this uncaring, unhealthy system. They've cared for people when they're sick, when they're injured and dying, when they're at their most vulnerable, and it is because of the caring people in those hospitals and systems that those people survive. It wasn't because of the corporations that implemented those systems.
That's right.
Our primary responsibility, and the reason many of us became nurses and healthcare professionals, is to protect the health and well-being of our patients and our country.
Yes.
It's important. Under our current system, the basic healthcare needs of tens of millions of people go unmet, while insurance companies, pharmaceutical companies, hospital systems soak up the billions in dollars in profit that should be going into providing healthcare.
Shame.
And never has that been truer than during the COVID-19 pandemic. This system is ineffective, inefficient, and unjustifiably unaffordable for our patients and for our country. But it is not inefficient or ineffective in getting profits for all of these companies. We have to change that.
That's right.
Yes.
That's right.
It doesn't prioritize wellness. It doesn't provide real, true health care, and it second guesses all of the doctors that prescribe treatments and medications and therapies for patients that accountants get to override, and they've never gone to medical school.
Shame.
More than 1.1 million people in this country died of COVID, and that's one indicator of how messed up this system is. Another indicator is roughly 16 million people who are currently suffering from long COVID. All of that was preventable, all of it, if they had listened to healthcare professionals and if we'd have a functioning public healthcare system. And while we're spending more money per capita, as was discussed, than other industrialized countries, the life expectancy at birth in the United States is lower than the OECD average. Avoidable deaths per capita is higher than the OECD average, and the U.S. has the highest rate of infant and maternal deaths. Just to give a few examples,
Shame.
we need a healthcare system that will prioritize the needs of our patients and provide equal access and quality and therapeutic care for every single person in the United States. A single payer system that would be a true system has been proven to do this effectively in many countries throughout the world. And nurses here in the United States are committed to make it a reality for our patients. We witness the personal impacts of our flawed healthcare system on our patients every single day. And those heartbreaking stories do not need to happen. Our primary responsibility and Anyway, I would like to thank you all for joining us here today on this momentous occasion because we are winning.
It's my honor now to introduce somebody who's just been such a stalwart leader and champion, held the first Medicare for All hearing, our ranking member of the Rules Committee, Jim McGovern.
First, let me thank Camilla and Debbie and Bernie and all my colleagues for being here today. I want to thank the advocates for being here as well. This is important. The bottom line is that we all want a healthcare system that puts people over profits. And this shouldn't be controversial. We all know how broken our system is. Even with great coverage, my own family has had to fight with insurance providers, argue over bills, stress out over whether or not certain treatments and scans will be covered. 3 years ago, our daughter was diagnosed with a rare cancer when she was 18 years old, and she is still being treated for it. If my wife were here, she would tell you the hours and hours and hours she spends sifting through all the bills. Many of those bills, by the way, are supposed to be covered by insurance, but you get charged anyway. You have to fight with them. And look at millions of people experience this exact same situation, but we're lucky because we supposedly have very good insurance, but there are a lot of people who aren't so lucky and who don't get treated and who die. Look, as Camilla pointed out, we held the first ever Medicare for All hearing in the Rules Committee, and it was my friend, our friend, an ALS advocate, Adi Barkin, told us how he had to go use a GoFundMe had to use GoFundMe to pay for care related to his ALS diagnosis. I mean, let that sink in. Even the Republicans on the committee were speechless. And if that doesn't make you think that this system has got to change, I don't know what could. The truth is that we are all just one diagnosis away from bankruptcy. And in the United States of America, that is unacceptable and should be a crime. As we're gathered here today fighting for Medicare for all, we have Republican colleagues in the House who are now making it their mission to cut Medicare. I mean, could they be more out of touch? How can they be so cruel, and how can they do this to people? So instead of cutting, we should be expanding and improving Medicare. Yes. Every single person should be able to get the care that they need. This shouldn't be controversial. 70% of Americans support it. It is not radical to say that health care is a fundamental human right. Yes. So, you know, we have some work to do, but the wind is at our backs, and I am confident we will get there. So I thank everybody for being here, especially the advocates who are here. Thank you.
Next up, we have my friend, an incredible champion herself on the Texas border, Congresswoman Veronica Escobar.
Buenas tardes, everyone. It's such a privilege to be here. I want to thank Mike and Joyce and Deborah for their powerful words. I want to thank my incredible leaders on this, my dear friend Pramila Jayapal, Debbie Dingell, and of course Senator Sanders, and the advocates. We would not have the number of co-sponsors without you. So this is your victory. Thank you. Before I was in Congress, I served in local elected government. I was El Paso, Texas county judge. That is basically the chief of county government, the head of county government. And under our county government in El Paso, we operated the El Paso County Hospital District, our public hospital. Year after year after year, our emergency room costs were going through the roof. Yep. And they were going through the roof because a quarter of our population in El Paso has zero health insurance. Yep. These are people who work hard every single day, but whose jobs do not provide coverage for them. And when they get sick, simply because they don't have health insurance doesn't mean their illness goes away. It means they get sicker because they cannot afford primary health care. Yep. And when you cannot go see a primary care physician, then what started out as something totally manageable can take your life. That's right. Yep. And we were seeing that in our emergency room in case after case after case. And even when we were able to help people get better, that emergency room was like a revolving door. Because people would then go back to their lives, go back to work, go back to their homes, and still not have health care. This is insanity. It is absolutely unconscionable. There is no reason why in our country, families, hardworking families and individuals should have to live this way, essentially avoiding a trip to the doctor because they cannot afford it. It is long past time that this country and this government do the right thing. We are witnessing tragedy after tragedy in our communities needlessly. And as many of my colleagues have mentioned, we saw that especially during COVID. El Paso was one of the nation's hot spots. Why? Because of our lack of access to health insurance. So our families, our individuals, our children were sicker. It's why we had row after row after row of portable morgues. We should not live this way. We don't have to live this way. It is a policy choice. And by God, we are going to change that policy. And I'd like to introduce one of our rising stars in the Democratic Party, an incredible leader from Florida, our wonderful
When I say everything, you say everyone, everything! Maxwell Alejandro Frost, proudly representing Florida's 10th Congressional District. With the heat we've been having this morning, I feel like I've been back in Florida. But it's an honor to be here today, representing my home of Florida, where nearly 5 million people depend on Medicare to get the care and the health care that they deserve. And look, I'm going to cut to the chase. This is personal for me, and like it is personal for everybody here. Last year in 2022, most of my year was either spent knocking doors, in my campaign office, or in a hospital with my grandma, Zenaida Argibe. I called her Yaya. She raised me for the first 2 years of my life. And I remember the morning that I got called in by my mom to go into the hospital at 1 a.m. when the doctors told us that she had just a few more days to live. Obviously, there's a lot going through your mind at that point. And I remember looking at the doctor and the nurse, and specifically the doctor, and saying, I have a question. If we were very wealthy, what options would be available for my grandma in terms of care and in terms of her being more comfortable? We were there for about 30 minutes as he explained the different things that were not available to my family and I because we were not of means and are not of means. Shameful. I think about that moment all the time because the morning that we put my grandma to rest in Hialeah in Miami, Florida, I remember that night going to my hotel room and saying, not one more. Yeah. Not one more. Because Yaya deserved way more than that. Because the people who die every day in this country deserve way more than that. And what this is it's not about Democrats versus Republicans or moderates versus progressives. It's about the people versus the problem. And what we know now, I'll tell you, on my campaign, I was pumping gas one night, all my buttons fell on the floor, and there was a houseless veteran who came up to help me pick them up. Started asking me about my platform, and he read on there, he said, Medicare for all, what is that? And I explained it to him. And this houseless veteran looked me in the eyes and asked, Maxwell, what do we have to do to deserve that? What do we have to do to deserve that? This movement is about love. This movement is about looking people like him in the eyes and saying, you deserve to be healthy by virtue of being alive, by virtue of being a human and nothing else. And that's what this is about. And to all my constituents in Florida's 10th Congressional District out there, I sign on to Medicare for All because I love you. And because when you love somebody, you want them to be healthy. When you love somebody, you want them to have the health care that they deserve. Here, people will talk about this being too expensive and etc. But the cost of not doing anything is far greater than the cost of taking this action. Yes, in terms of dollars and cents, but also in the ultimate cost, human life. And so I'm proud to be here with Representative Jayapal, Representative Dingell, Senator Bernard Sanders, and the amazing advocates here as we fight for a world that we all deserve to be in. Thank you so much. And now I have the honor of introducing my dear brother from California, the president of our freshman class, Representative Robert Garcia.
Hey everyone, it's really an honor and a pleasure to be here with all of you. I especially want to start by thanking Representative Jayapal, and your leadership on Medicare for All to those of us across the country has been really inspiring. So just give her a big round of applause. Thank you. I want to talk about something that has got to be discussed more, and that is the support for Medicare for All in our cities and towns across America. Now, back in 2016-2017, I led with a group of our nurses from the California Nurses Association a resolution to support single-payer health care at the state level in California. We passed a resolution at the city council. When I was mayor for 8 years, I was proud that Long Beach joined a coalition of cities across the country supporting the movement that you all started. And so do not forget, there are over 100 cities and towns and jurisdictions, and growing every day, that have passed resolutions supporting Medicare for All. This is not just a national issue. This is a local issue. At the local level, mayors, council members, our local nurses advocates are begging us to do something. They're begging us for change. I want to say one thing that's very clear. Medicare for All is not controversial.
That's right.
Medicare for all is not a radical idea.
That's right. Everybody else doing it.
It's very simple. We have a program in the U.S. that people already know and love, and that is Medicare. What this movement is about is ensuring that everyone has access to something that we know already works.
Yes.
We need to continue this energy around Medicare for all. We know that healthcare is a human right for everyone.
Medicare for all. Medicare for all.
Absolutely.
Medicare for all. Medicare for all. Medicare for all. Medicare for all.
And let me close just by saying that this legislation is common sense and it's good for everybody. So thank you. I'm proud to be part of it. I want to introduce a leader, a progressive leader in our caucus, Jamal Bowman.
What's up, everybody? How we doing? Thank you so much, Representative Jayapal, for your visionary leadership and your love for humanity. Thank you so much. Thank you to all the advocates and organizers who have been fighting for this for years. Thank you so much. Thank you to Senator Bernie Sanders for leading and being a visionary for our country. Thank you so much. Come on, people. This is common sense. What the hell are we talking about? We cannot claim to be a healthy democracy. We cannot claim to be a healthy society. We cannot claim to be a leading voice in the world on any issue if we can't provide access to health care for every single person in our country. We are fraudulent as a nation if we can't provide health care for everyone. This is common sense. We brag and boast about our wealth. We brag and boast about our strength, but we can't even provide access to health care for everyone. This is unacceptable, and this is inhumane for us as a nation to behave in this way. And when we say Medicare for all, let's be very clear on what we mean. We mean optical. We mean dental. We mean hearing. We mean mental health. We mean whatever anyone needs, they should be able to go to the doctor and receive it. We have wealthy individuals in our country taking vacation space trips out of space, spending billions of dollars, trillions of dollars on nonsense, while we are letting the most vulnerable people die in our country because they don't have access to health care. Shame! This is about rooting our economy, rooting our democracy, rooting our society in our collective humanity. We have to center care in all of our legislation. Care for all people, particularly those who are most vulnerable. That's what Medicare for all is all about. And so we're going to continue to fight, and we are going to win this fight. And we're not going to win in 50 years or 40 years or 20 years. We're going to win right now. And I'm going to tell you how we're going to do it. We got a big election next year, not just for the presidency. We have 33 Senate seats up for grabs. And our number one issue is low voter turnout. If we increase voter turnout in states across the country, if we increase voter turnout in counties in those states across the country, we can get the right senators into office who support Medicare for all and vote the wrong senators out of office. And Democrats are going to take back the House. We're going to win the White House. We're going to have all three. And then we're going to suspend the filibuster so that we can pass. This press conference is a continuation of the movement that has been going on for years. But we can't relax and go to sleep after this Congress. Email, write, call, knock doors, go on social media, Do whatever it takes, because this is a central aspect to saving our democracy. Are we with this? Are y'all with us? Let's get it done. Thank you so much.
Again, 1,000 thanks to all the advocates. Give it up for all our amazing movement. We have 112 co-sponsors in the House, the most that we have ever introduced to it. We are going to continue to build that list because you are going to be out there in your districts making sure that your representative is signed on to Medicare for All